For this photo voice documentary, I will be discussing some dental disparities in the elderly population. At the moment, I'm working in an office with a large elderly population, and I hope to see the following needs, such as dental anxiety, physical limitations, and most commonly financial struggles. All these needs leads to untreated diseases and inconsistent care, which ultimately affects their overall health and quality of life. This photo voice documentary will talk about the needs and barriers to care of this population and various solutions to these challenges. Some of the population needs that I have identified are limited access to dental care, which includes transportation and living in assisted living homes, physical and emotional challenges like systemic conditions, age, oral conditions, and dental anxiety. Financial challenges, lack of insurance, and limited income or retirement money. And lastly, health literacy, which includes dental terminology or hygiene instructions, which all leads to non-compliance. Addressing these disparities will not only be beneficial for oral health, but also for the overall health and well-being of adults. First, we'll start with limited access to dental care. Many of the adults can no longer drive or not allowed to drive, so they can no longer take themselves to dental appointments. Many also live in assisted living homes where most of their care depends on their caregivers. According to a federal report, about 1.4 million adults reside in nursing homes, and only 60% of those adults receive oral care, which mainly consists only of toothbrushing. It shows that nursing homes have limited capability to deliver the needed oral health services, putting residents at a high risk for oral diseases. Dependency also varies between the older population. It can range from at least functional independence to being fully dependent. Most of the older adults have at least one chronic condition, which can vary from hearing loss, back pain, vision loss, to bigger problems like cardiovascular conditions or neurological problems. There's also physiological changes like body temperature or function loss of body systems. These older adults can become fully dependent on family members or caregivers, making it difficult for them to access dental care. Next, we have physical and emotional challenges. I have listed a couple subgroups that address the goal with the challenges, like dental anxiety. Many older adults don't not seek dental care because of their anxiety due to past trauma, systemic and oral conditions, mental disabilities, hospitalizations, dexterity, and nutrition. I would like to talk a little bit more about systemic and oral conditions for this presentation. We know systemic conditions can exacerbate oral conditions like tooth loss, periodontal disease, caries, which are mainly prevailing in older adults age 65 or older. According to the National Health and Nutrition Examination survey data, 40% of adults experience tooth loss and 13% have loss of oral dentation. Just like the systemic conditions affect the mouth can also affect those systemic conditions. For example, oral health can impact dietary intake, resulting in nutritional deficiencies and ultimately worsening conditions like Alzheimer's, Parkinson's disease, diabetes, high blood pressure, and other cardiovascular diseases. Next, we have financial challenges. Lack of insurance is a big one. According to the CDC in 2015, the percentage of people in the US with no dental insurance was 29% overall and 62% for older adults. Many of those older adults lose their dental benefits upon retirement, and many adults with low income do not have any dental insurance. Um, Limited income and retirement money is also a really big contributor to these disparities. According to the CDC, complete tooth loss was more than twice as common among older adults with low incomes compared to those who had higher incomes. National data also reveals that adults with incomes below federal poverty level have more untreated cavities than those with higher incomes. Overall, the prevalence of untreated caries and periodontal disease was high, approximately 96%. Also, tooth loss in cavities and periodontal disease is more prevalent in African American and Hispanic individuals. Untreated cavities were 3 times as common among non-Hispanic Black adults and more than 2 times as common among Mexican American adults compared to those who are not Hispanic white older adults. Overall, disparities are most pronounced among those with inadequate financial resources. Lastly, we have health literacy. Many older adults do not understand any of the dental terminology or the treatment that we recommend or the oral hygiene instructions we educate them through the appointment. According to the CDC, complete tooth loss was more than 3 times as common among older adults who had less than a high school education compared to those who had more than high school education. So everything was technically correlated to the educational level they were received in the past. In summary, oral health literacy levels is low among older adults, especially with those with low income and minority populations. This is correlated with the lower utilization rates of dental services. So individuals with limited literacy are less likely to seek care. According to the US Census Bureau, the number of adults aged 65 and older is projected to reach 98 million by 2060, resulting in the urgent need for effective intervention to address disparities. So now that's what solutions that I have listed are the following. The first one, CDC's Division of Oral Health, DOH efforts. They have been working in the past years in developing and promoting infection prevention and control guidelines for dental settings, working to integrate medical and dental care, funding state, territorial, and tribal oral health programs, hosting the CDC Dental Public Health Residency Program, and conducting all health-related research. Another solution will be public education and health literacy campaigns, specifically working or focusing on geriatric dentistry. This can improve oral health literacy among older adults and caregivers, which could facilitate better understanding and utilization of health and oral services. It can also enforce an emphasis on the importance of routine dental visits, the relationship of oral conditions to the mouth, dentures, etc. And focusing on geriatric dentistry will be specifically for preventative care, polypharmacy effects, and the treatment of age-specific conditions. Also, expanding Medicare coverage can reduce disparities in underserved populations, hopefully increasing federal funding for oral health programs can enhance access to care and preventative services. Community-based mobile dental clinics. This can improve access in rural areas, providing preventative services. and this can significantly benefit those with transportation limitations as well. There's also floral programs and dietary guidelines. These can emphasize the importance of nutrition, it, hopefully to help mitigate the impact of oral health on diet and nutrition. Addressing the disparities will not only be beneficial for oral health, but also for the overall health and well-being of adults. And here are some other references that I have used for this documentary. Thank you for listening to this.